live later, or when will these go live? Testing, testing. Okay. Testing, testing. Testing. Good afternoon, friends and colleagues. I think more colleagues will join us shortly, but I think so we start on time. My name is Doug Betcher from the World Health Organization, so I'm one of the co-chairs for today's session. Thank you for sequestering part of your lunch time to join us for this exciting panel today. First, I want to remind you, as per the slide here as well too, that the Conference Tobacco-Free Pledge is ready for your sign-up. You can sign up on the app, on the union website, and please do it. I think there's no excuse for us not to be part of the very much needed tobacco-free pledge, both for reducing deaths from tobacco use, but also reducing death from TB use. So we've got a really exciting discussion ahead of us, and we want to get you involved in the discussion as well too. We're going to focus this session on challenges, science, and regulatory dynamics of novel and emerging nicotine and tobacco products. Let me just move on to the next. And as many of you know, there's many myths about these, untruths about these products, so we want to, as much as possible, humanly possible, dispel some of the myths about the science, also share with you some of the late-breaking news on threats to lung health. We want to also point the way forward in showing how countries are responding, and also along that route as well too, to share some of WHO's, the World Health Organization's recommendations to countries and partners. So first of all, we should accept a baseline premise that these products are harmful, especially to children. We're going to be discussing two distinct categories, and make sure you keep these categories separate when you think about them. Electronic nicotine delivery systems, which are more commonly referred to as e-cigarettes, or heated tobacco products. ENNDS, or e-cigarettes, do not contain tobacco, but in many jurisdictions, many countries do regulate them as tobacco products, where heated tobacco products are 100% tobacco products and should be regulated as such. Countries are taking approaches to regulate these products in a number of different ways, which we'll hear about. These are guided by the interpretation of the scientific evidence. By no means is the scientific evidence complete. Unfortunately, wherever we have tobacco or related products, we have tobacco industry interference. We're going to be discussing that. And also existing regulatory frameworks are also guiding countries, and these are always in a state of flux. To make things more complicated, the ever-present tobacco industry also, as a marketing ploy, have started conflating these two products. E-cigarettes ends with heated tobacco products, referring to them as safer options, harm reduction, basically to negotiate better regulatory arrangements for themselves. Now, the rapid emergence and evolving design of these products, which is occurring at a, I would say, dizzying pace. It's hard really to keep up. And this, as a result, is opening up marketing obfuscation, lies, more simply, scientific manipulation, also industry manipulation of the regulatory process. Through all of this obfuscation, the tobacco industry and their front groups are trying to market themselves as part of the solution. Many of us in this room, I hope everyone in this room, doesn't find that a very credible option. And that would be completely in conflict, for example, with the WHO Framework Convention on Tobacco Control, WHO's first treaty, and specifically Article 5.3 on tobacco industry interference. And this lumping and clumping of these products together is really, by the industry, is really confusing consumers. And for those of you that have been involved in tobacco control for some time, you would see that many of these tactics come straight out of the tobacco industry playbook, and they're very reminiscent of the nefarious, and I will underline nefarious, tobacco industry golden age of the latter part of the last century. So we're going to be discussing harm reduction, and I've referred to the tobacco companies as actually kidnapping the concept of harm reduction as their paradigm for marketing these products. The design and marketing of the tobacco industry for these products and pushing the harm reduction approach is a very stark contrast from what we know as credible public health-led harm reduction approaches. We have many. For example, injection sites, safe injection sites, needle exchanges, methadone and naloxone public health programs are strictly regulated, highly medicalized, directed very specifically to users. They don't include these flashy billboards, what I would call the reboot of the tobacco industry playbook in marketing a tobacco harm reduction approach, which, as I said, is really it's a kind of like reboot of the tobacco industry interference strategies for the 21st century. We will summarize in a sense here that the science for ENNDS, e-cigarettes, is still inconclusive as far as marketing these products for cessation aids, and again, repeat that heated tobacco products are always to be regulated as tobacco products. At this point, I wanted to share with you the idea that we're living in a living natural experiment, a very dangerous one, especially a dangerous one for youth. And that's why I wanted to play. It's a 25-second video from the U.S. Truth Campaign, which I think really, tongue-in-cheek, but really hits the right spot for our discussions here.
In a wild turn of events, animals are demanding Juul not test on humans. Mario?
No one knows the long-term effects of juuling, so any human who uses one is being used as a lab rat. Thank you.
Let's hear from Doug the Pug and his fellow protesters.
I will never stop fighting Juul. Or the mailman.
Nicotine is trapping humans in a growing cycle of addiction. Oh, excuse me.
Thank you, Cupcake. Fact, no one knows the long-term effects of juuling. Do you?
So I think that puts it pretty straightforward, actually, some of the challenges we're facing with these marketing campaigns. Recently, The Lancet came out, and I thought a very good quote stating that vaping as a harm reduction strategy will require rapid but robust research and rigorous safety monitoring systems. Everyone deserves a smoke-free future, but the path must be transparent, informed, and navigated with caution. And just 2 weeks ago, the Lancet came out again, calling for a public health approach, stating that it is time to align the public health approach to e-cigarettes with that of cigarettes. A very, very clear regulatory statement. So with that short introduction and overview of the scope of our session, I want to introduce you to our extremely talented colleagues that are part of the panel. First of all, each speaker is going to present their case, their main points for our discussion. Then my co-chair, raise your hand, Jagdish Kaur, raise your hand. She's my co-chair, and she will, along with me, then we'll have an interactive discussion with a few questions that we'll pose to the panelists, and then we're going to open it up to the floor, both with the live mic and also the app, which we'll explain to you. We have three main speakers, experts. Dr. Ranti Fayakun is our first speaker. She's the National Tobacco Capacity Scientist from the Tobacco Free Initiative in Geneva, Switzerland, followed by Dr. Gan Schwan, who's the director of the Union's Tobacco Control Program in New York, followed by Dr. Swasti Charan, who's the Chief Medical Officer of the National Tobacco Program in the Ministry of Health in India. So with that short introduction, I give the floor to you, Ransi.
Thank you for that nice introduction, Dr. Becher. So today I'm going to be giving a brief overview of the science of novel and emerging nicotine and tobacco products, and go over the science, basically the state of science, what we know about science for now. Then I'll talk about the challenges and then the regulatory action taken by some countries, as well as WHO being an international organization. Broadly speaking, there are three main categories of these products. You have ENDS, which is electronic nicotine delivery systems, of which e-cigarettes are the most common. And the heater liquid containing nicotine, propylene glycol, vegetable glycerin, and flavors to generate an aerosol, which is inhaled by the user. Then we have the electronic non-nicotine delivery systems, which essentially are the same as ENNDS, but generally without the nicotine. And last but not the least, the HTPs, we have a set of products that use a device to heat up tobacco to generate nicotine, a nicotine-infused aerosol, which is inhaled by the user. Now moving on specifically to electronic nicotine delivery systems, broadly speaking, we can classify them into two main systems. You have the closed vaping systems, which bear close semblance to their conventional counterparts, and then in recent times, you have the introduction of unconventional variants of these products, such as Juul, as you can see on the screen, which looks like a USB flash drive. And on the right-hand side of the screen, you have open vaping systems, which are more or less easily customizable and can be filled with liquid or any other substance. So, if you gave me the whole of today, I couldn't possibly go over the science of ENNDS, but I will try and summarize it in about 2 minutes. These products are quite diverse, and more or less the health effects elicited by these products are influenced by several factors. One of them is the ability to manipulate these products. You've got the liquid composition, you've got the mechanics of the products, and you've got other factors that play a role. You have, in terms of nicotine, we all know that this is the major addictive substance in these products. So some of these products have been demonstrated to be able to match nicotine delivery generated by conventional cigarettes, and some of them less. Most of them include flavors, which are toxic and attractive to young people. And we know from the current knowledge that young children who experiment with these products actually go on, or could progress to go on to use conventional cigarettes. Then a lot has been said about whether these products are effective cessation aids, but the fact of the matter is some products have been, under certain conditions, have been demonstrated to help some people to quit smoking, whereas some have had the opposite effect. Then the majority of people who use these products, actually greater than 50%, actually use them in conjunction with other tobacco products, something we know as dual or polyuse. Then the long-term effects of these products are unknown. They contain toxic chemicals to which users can be exposed, and basically are harmful to health. So this leads me very nicely onto the concept of E-Valley, which is a newly coined term to describe the lung diseases basically reported in the States in recent times. So as of the 29th of October, there have been 1,888 cases of E-Valley, which stands for e-cigarette or vaping product use associated lung injury, and I think we're up to about 37 deaths actually, and this number is expected to grow. So the cause is yet unknown, but it is thought that THC plays a role, or actually in the majority of cases reported, THC has been implicated in those, but then we've had some cases with the exclusive use of nicotine. So this is not unprecedented because the first case was reported in 2012 and they presented in various forms. So you have liquid pneumonia, acute lung injury, you've got lipid pneumonia, and some of the others as well. So these products have been on our radar, WHO, for quite a while, and we submitted 2 reports to the Conference of the Parties in 2014 and in 2016, in which we presented or proposed some policy options for countries that have not banned these products to more or less follow. So the first one is to prevent initiation of non-smokers, minors, and vulnerable groups, then to prevent the use of unproven health claims, also to minimize the health risks to users and non-users, and to protect against tobacco and vested interest. The Conference of the Parties also invited parties to consider prohibiting or regulating these products in 1 or 3 categories, either as medicinal products, consumer products, or tobacco products, or any other category as appropriate, while taking into consideration a high protection or high level of protection for human health. So in terms of regulatory action, countries are being guided by their regulatory context, and a report that was submitted by the Convention Secretariat to the 8th session of the Conference of the Parties noted that countries currently classify these products into 1 of 7 categories as listed on the screen. And then you've got an 8th category, which is tobacco-related products, which is more or less akin to countries within the EU. On the right-hand side, you can see that 33 countries have already banned these products, and then according to our internal data, we have some countries that regulate as tobacco products, and then 30 as medicinal products, and 41 as consumer products. And they've used a range of mechanisms to do this. Now moving on very swiftly to heated tobacco products. These are an emerging class of tobacco products, and they contain tobacco, and the same toxic components or constituents that have been found in tobacco products have been found in these products. So, and then based on current knowledge, we are not able to more or less separate these two because we've not been able to demonstrate that these products are substantially different from other tobacco products. They have health effects associated with them, and even though generally we have reduced exposure to toxic substances, that does not translate to reduced risk. In terms of regulatory guidance, at WHO, we recommend that these products be regulated as tobacco products, given that they contain tobacco and there's no evidence to suggest that they're different from conventional cigarettes. And the advice is to apply fully the provisions of the same regulatory measures that apply to other tobacco products. In terms of global regulatory challenges, there's so many of these, but I've just listed a few on the screen. So these products, because of their unconventional nature, present unique challenges to regulators, such that, the definitions of existing definitions in national laws don't necessarily cover these products. There is also a lack of regulatory frameworks and country capacity to regulate these products, which means that the tobacco industry is able to use that as a loophole to negotiate more favorable regulatory treatments. Also, in terms of ENNDS, some of them, as I said, are they're customizable and they can be manipulated either by the manufacturer to deliver, to alter the delivery of the substances from these products, and then it can also be manipulated by the consumer, and you have loads of people who actually do it themselves at home. Then you have, I think, Douglas alluded to this, incomplete science. So how do people navigate science? Because it's actually quite complex. And then you have manufacturers promoting these products as reduced risk products, and without actually the evidence to substantiate this. So they tend to conflate the product categories. So in conclusion, for the purposes of this presentation, there are three distinct categories of products: electronic nicotine delivery systems, electronic non-nicotine delivery systems, and heated tobacco products. These products are harmful to both users and non-users. In terms of ENNDS and ENNDS, they have consequences for lung health. ENNDS also, in terms of regulation, should be strictly regulated where they're not banned. And HTPs, as I said, should be regulated as tobacco products, fully applying the measures of the WHO FCTC.
Great. Thank you very much, Ranti. Dr. Ganshwan, you're next. Thank you.
Thanks, Doc. So Dr. Ranti just gave you a broad overview of the science behind e-cigarettes and HTP, as well as the regulatory options. I'm going to dive a little bit deeper and talk about the challenges of regulating these products in a developing country setting. I'll be using the examples of the 10 Bloomberg product countries plus Turkey throughout my presentation, because this is where we, the union, mostly working, but the challenges we're facing in these countries should be applicable to other countries as well. Probably the most important topic in the whole e-cigarette debate is the gateway effect among children. I'm citing the 2018 report from the National Academy of Science, Engineering, and Medicine in the US. The conclusion in this report about gateway effect is there's substantial evidence that such gateway effect exists. I should mention that most of the studies to date on the gateway effect are from the US, and we haven't seen many studies from the developing country settings. So the question really becomes, do we expect similar gateway effect in a developing country setting? When we talked about gateway effect among children, it's really not just about the product, it's also about the setting. It's about the factors in the environment that can influence the pickup of smoking. So if we compare the settings between countries such as the US and the other developing countries such as Bangladesh, Indonesia, Turkey, we can see the smoking rate in these developing countries are much higher. And smoking is still more or less an accepted behavior in these countries. And cigarettes are still widely available in these countries. So if I have to compare, let's say, if I have to compare a boy from China who got addicted to nicotine through e-cigarettes, and the boy from the UK who also got addicted to nicotine through e-cigarettes, I'll be more worried about the Chinese boy, as he may go on and become a smoker. There's more likelihood. And I should also mention that there's lack of evidence on the gateway effect of HTPs. Cessation potential of e-cigarettes is a very contentious issue in the debate of e-cigarettes. I know among the tobacco control community, we have very different opinions in terms of the cessation potential. Again, I want to cite the conclusion from the same report. It says there's limited evidence that e-cigarettes may be effective aids to promote smoking cessation. I really don't want to talk about the our opinion in terms of cessation potential per se. I want to mention there's very little evidence from the developing countries. Let's step back a little bit and let's look what happened in the US in the past 50, 60 years. As you can see from the graph on the right-hand side, the smoking prevalence among men in the US peaked in 1954 at around 55%. And in the next 40, 50 years, millions and millions of smokers in the US quit smoking without having to use e-cigarettes or without even having to use an RT. So what prompted these people quit smoking? If you look at the graph on the left side, we see major reports on smoking and secondhand smoke being published. And we see the movement of smoke-free environment. We see the tap ban being introduced. We see tax being raised. We also see litigations against the tobacco industry. So let's look at the developing countries on the right-hand side. Let's say if these countries can implement empower measures, just like the US or for the similar matter in the UK, then these countries' smokers, which is still at the peak, many of them, I would say hundreds of millions of them should be able to quit smoking without having to use e-cigarettes or even an RT. We know many, many smokers can quit on their own with cold turkey. So as you see from the experience from the US and many other countries, empower is really the solution for quitting. This table is adapted from the WHO 2019 report. If we compare this table with 2018, we will see a lot of progress in empower have been made in these developing countries. But if we look very closely, we still can see many gaps: smoke-free, health warnings, tax ban, not to mention taxation, which is the most important tobacco control measure, but also is the tobacco control measure where we have made the least progress. If you look at the affordability of cigarettes, the picture becomes even more bleak. I guess the message here is there's still many gaps in empower. We shouldn't be misguided by the industry argument. We have done so much in power, and now let's try the new solution, e-cigarettes and HTP products. Many gaps still remain. Let's keep focused on empower. It should be no surprise to people in the audience that enforcement of tobacco control policy is a major challenge in developing countries. I'm using the example from Indonesia here. No offense to colleagues from Indonesia, just for the convenience purpose. As you can see, there are major gaps in compliance, in tax ban, in smoke-free law, and in no sale to minors. Many, many problems in the enforcement mechanism. Let's say with the very limited enforcement capacity, if we want to ask the enforcement agency to work on e-cigarettes and HTP products, let's ask them to enforce tax ban, let's ask them to enforce smoke-free law, let's ask them to enforce the no sale to minors. They will be overburdened. Realistically, I wouldn't be surprised, nothing will be done. We're simply introducing another problem. Speaking of tobacco industry, we are seeing the tobacco industry producing more and more of these products. Needless to say, the tobacco industry is dominating the HTP global market, with IQOS being the leading brand. And we are also seeing the tobacco industry controlling a significant portion of the e-cigarette market as well, about 1/3. So it becomes very clear, as we have seen in many, many countries, the tobacco industry are really using these new products as a means to interfere in policy. Their claim They are the harm reduction advocates. They are claiming they're the solutions rather than problem, so that they can be engaged in policy discussions with policymakers. Speaking of tobacco industry and harm reduction, we have to mention the Foundation for a Smoke-Free World. This is not a new tactic by the tobacco industry, but simply because the scale of the funding, we are really expecting this to be a major threat for tobacco control. This Foundation for a Smoke-Free World was launched by Philip Morris in 2017 with a funding of close to $1 billion over 12 years. So the Foundation for a Smoke-Free World claims to be independent from Philip Morris, despite that every dollar comes from Philip Morris. If we look at the funding directions of this foundation, they fund harm reduction, farmers' livelihood, and industry transformation, very much in line with PMI's strategy. Farmers' livelihood is a strategy that's been used by the tobacco industry for a very, very long time. The foundation also claims they support FCTC implementation, but at the same time, they are violating 5.3 by funding many organizations with links to the tobacco industry. Ever since the foundation was launched in 2017, WHO, the Union, CTFK, Johns Hopkins have all issued statements calling countries and governments and organizations not to work with the foundation. In early 2018, Bloomberg Philanthropies launched the STOP initiative, in which the union is a partner. So monitoring and exposing the foundation's link with PMI has been one of the focuses of STOP. I have listed here a few activities STOP has been doing over the past 12 months. I will not go into the details of them, but I do encourage you to go to the STOP's website, exposetobacco.org, to learn more about this initiative. So, in conclusion, there are some unique challenges with regulating e-cigarettes and HTPs in a developing country setting. We don't have evidence on gateway effect or cessation potential, but there is a potential concern the gateway effect might be greater in a developing country than we have seen in a country like the US. There's also a concern about the e-cigarettes being a cessation product. If these countries can implement empower measures, we will be able to see hundreds and millions of smokers quitting smoking without having to use e-cigarettes or even an RT. We have to be focused on empower. Empower is the solution. We have still many gaps remaining. There are challenges with enforcing HTP and e-cigarette policies, obviously, in the developing setting, and industry has been using these products as a means to interfere in policy making. Because of these challenges, and also because there's a general lack of health evidence, we do recommend countries to adopt a precautionary approach. Our next speaker, Dr. Swasti, will be talking about India's experience to ban e-cigarettes and HTPs. We do highly recommend countries to consider seriously the experience from India, and also to follow the example of India to ban e-cigarettes and HTPs. We need to focus on Empower and 5.3. E-cigarettes and HTPs are not a solution for developed countries. They are rather a distraction. Thank you.
So, thank you so much, Dr. Kwan, for a very comprehensive view of the regulatory challenges, especially with context to the LMIs. And Dr. Swasti Charan, welcome.
Good afternoon, ladies and gentlemen. We have had scientific evidences pointing in different directions. And I would like to share with you the next few minutes how a country like India has done for action against ENNDS. The Indian experience is an extreme form of regulatory approach. This is a complete prohibition for ENNDS, ENNDS, and HTPs and the like devices. At the first outset, I would like to inform each one of you that the countries at the world are at various stages of the tobacco epidemic and also at the varying levels of implementation of the WHO FCTC or the WHO Empower strategy. And the parties, of course, tries to strive and implement the articles of the FCTC. And in order to protect public health, parties are also encouraged to implement measures which are well beyond those required by the convention or its protocols. Nothing in the FCTC stops taking any appropriate action which is best for that particular country. This becomes more relevant while dealing with novel products like electronic nicotine delivery system or the electronic non-nicotine delivery system or the heated tobacco products. So the Indians' approach to this has been based on various serious thinking way back in 2013 and finally in 2014 we had a national consultation wherein there was a consensus to ban these products, particularly ENNDS at that time. During the consultation, we also had 3 subgroups. One was on health effects, and the other subgroup was on the advocacy and the IEC, and the third subgroup was on the legal aspects. So whichever actions you are going to take in future, these 3, we assume, would be necessary for our country. All the 3 subgroups, subsequently after a series of meetings, submitted the report to ban ENNDS to the ministry. Concurrently, during that time, some states had also taken up on their own to ban ENNDS, taking various provisions available to them, the health being a subject of the state in this country. And avenues for banning ENNDS and HTPs were explored under various legal provisions like the Drugs Act or the Poisons Act, etc. Finally, India promulgated an ordinance to prohibit electronic cigarettes, the production, manufacture, import, export, transport, sale, distribution, storage, and advertisement on 18 September 2019. It wasn't a very easy cakewalk task. In 2018, in August, the Ministry of Health issued an advisory to the states to ban ENNDS except as approved under the Drugs and Cosmetics Act in 1940. Necessary orders were then issued to implement the advisory to the concerned field officers who are responsible for implementing the order. But in March 2019, the High Court of Delhi stayed the operation of the 3 letters issued by the field officers, and ministry was then engaged in a legal battle. In around April or May, the ICMR, to be precise, on 31st May 2019, ICMR publishes a white paper on ENNDS, which gave strength to strengthen India's stand for banning e-cigarettes and the like devices. Though the thought process for ban under the Drugs and Cosmetic Act continued, the prospect of the ban under a separate promulgation of an ordinance to ban e-cigarette was born during these days. And in August 2019, Ministry of Health filed counter affidavit, and the matter is again listed in 19th November 2019. And during this time, unfortunately, for those people who are dying, the first death reports started pouring in due to vaping in US, and it escalated during the following days. And in August 30th, the CDC issued health advisory on severe pulmonary diseases associated with e-cigarette products. And around September, close to about 450 cases of vaping-related illnesses reported in the US. And that was the time when the country thought that there is enough evidences, there is enough circumstances to promulgate the ordinance to prohibit electronic nicotine delivery system or ENNDS or any of the like products available in the country on 18 September 2019. So the issues and the challenges for and the tobacco industry, the story has been very predictable. Whenever any action is taken for tobacco control by tobacco control division in any country, it was predictable that the tobacco industry will react, distort facts, and challenge in the court of law. And during this process, these were also the challenges for us. Papers were published by some sections of the scientific society supporting the ENNDS as a quit device, and these studies were again quoted in the court of law, and the social media, especially the Twitter and the newspaper articles, came from the industry. It was countered in all the manner. Prominent people again wrote articles why the ban was essential. The health minister himself wrote an open ad. And if you remember, way back in 2014, we already had 3 subgroups which were working on the legal aspect, the health aspect, and the advocacy and the IEC aspect. So the 3 subgroups became very powerful, very strengthened, while trying to address the issues and the challenges during that process. The preparation, as I said, was on solid ground, and all important stakeholders were involved. The 3 subgroups, as I said, were actively engaged. And we also quoted strongly the white paper by ICMR, which is the highest scientific body for research in this country, and also referred to various reports, including the Surgeon General's report. And examples of similar ban or the prohibition by, on ENNDS by other countries were also referred to. And the sub-health group involved higher officials like the DG of the Director General of the ICMR himself, and the Director of the All India Institute of Medical Science, the most premier institute of this country, were also involved during the process of the sub-health, the subgroup on health. The civil societies also supported the ordinances and throughout the process. And we finally, in a way, nullified the claims of the industry and also the friend groups with all the scientific arguments that we had prepared so far. So the conclusion I would like to provide here, and the take-home messages is, any tobacco issue needs to be examined in a wholesome manner. A holistic view, therefore, needs to be taken. Maximum good for maximum people needs to be the priority. What is best for your country needs to be adopted. Ordinance, for us, was the answer to these questions, to ENNDS, ENNDS, and the HTPs and the like devices. Thank you very much.
Thank you so much, Dr. Swasti Charan, for taking us through the journey of India, which took more than 5 years. So it was a long battle and finally won. And other countries are looking towards India, how they can also regulate these products. So now we'll be moving forward to an interactive session. We'll be asking first questions to the panelists, the speakers here, and then we'll move forward to an open discussion and invite questions from the audience. So we'll starting with Dr. Fayakun. So my question to her is that, can the regulatory recommendations set out in your presentation be applied in all settings, and to what level have they been implemented globally? Over to you, Ranji.
Yes, I would say yes, because the recommendations are broad enough to be applicable in different contexts. And the regulatory approach taken by a country has to be guided by the country's national context. So if you take the first one, for example, which is preventing youth initiation, it can be done in a number of ways. A country can choose to maybe restrict flavors, for example. They can choose to restrict advertising, promotion, or sponsorship. Or in the case of India, they have chosen to ban the product, so which is a viable regulatory option. So I would say yes to your question. And the other bit of your question in terms of to what level they have been implemented in countries, we haven't really measured across this regulatory space because countries have implemented the measures to varying degrees. So if you take the first one, I will use the first one as an example again, preventing youth initiation. You have a whole raft of requirements as subsets of that particular objective. So a country may have gone for options 1 or requirement 1 and 2, but not done anything about 3 to 5. So basically, it's very difficult to, or we haven't actually done that. So I don't know if that answers your question. Okay.
Next question for Dr. Ganshwan. We know the tobacco industry is a real bugbear for our tobacco control work. I wanted to have your views on how the industry interference and regulation of these novel products differ, if at all, from the playbook and tactics that the industry has traditionally used.
Thanks, Doc, for the question. I would say there's a lot of similarities between what we see now and what we saw from the industry a long time ago. Maybe I can use the example of the Foundation for a Smoke-Free World. When I look at the Foundation for a Smoke-Free World, it really reminds me of, some of you might know this, it's called the Center for Indoor Air Research, which was established in 1980s when the secondhand smoke became an issue. Also, the Center for Indoor Air Research was funded by the tobacco industry, claimed to be independent from the tobacco industry, funded the scientists to produce the kind of evidence that industry needed, and they even coined the term environmental tobacco smoke, which was used by many of us until the early 2000s. This Indoor Air Center for Indoor Air Research funded a lot of studies that looked into the link between lung cancer and cooking fumes among women, a distraction from the distraction strategy from the real issue of secondhand smoke. Exactly the same strategy we're seeing from the foundation. We're not sure if the farmers' livelihood is a destructive strategy, but it's certainly one of the consequences. They're asking countries to work on this area, and it's a distraction from the real work in tobacco control and power. I think almost every 20-something years, the tobacco industry will come up with a solution. Last time it was low-tar cigarettes, and now it's HTPs and e-cigarettes. So really, we are seeing the industry repeating itself. And speaking of JUUL, we're seeing the JUUL hiring government officials, lobbying for JUUL preemption policies, age 21, very much following tobacco industry's playbook. So I guess, as tobacco control advocates, we have learned a lot from the tobacco industry's past. There's every reason we need to be vigilant and suspicious, because we know the tobacco industry is always one step ahead of us. Sometimes the one step means a couple of years, sometimes it means a couple of decades. So we need to be very, very vigilant about this.
So next question is to Dr. Swasti Charan. So we would like to hear from you, like how India's experience to ban and then the subsequent response will help or guide other LMIs, so low and middle income countries who want to go ahead with regulation to ban. So what will be your, thinking for them? Thank you.
Thank you, Dr. Jagdish. That's a very relevant question. Although India has taken the action considering the best for the country, I think every country, whether they're LMICs or HMICs or whatever status they are, they should examine themselves where do they stand in the tobacco epidemic cycle and where do they stand in the tobacco control cycle itself. I would like to call it a cycle again. And then decide based on the evidences available throughout the world, then decide what is best for that country. Well, if you want to go the Indian footsteps, we have already set it out for you, the ordinance for a complete ban for prohibition of ENNDS, and even the HTPs. So we have set an example, but every country should decide on its own merit to take the best decision for themselves.
Great, so we're eager to open the floor to your questions as well too, so get those ready. We're just going to open up for a couple of rapid-fire questions, so the panelists as well too, really brief answers, 20 seconds or whatever. We're going to questions that anyone on the panel is at liberty to answer. So we've heard a lot about scientific uncertainty. So how do countries navigate the science when deciding on regulation of these products, given that there is still a great deal of uncertainty in the scientific evidence? Who wants to jump into that question first? Ranti?
I'll jump in. Obviously, as I mentioned before, the uncharacteristic nature of these products more or less present challenges to regulators, and it's a real challenge to navigate the science. But what I would say is, obviously we know that there's a lot of cherry picking going on, and but I would urge countries to rely on the evaluation of evidence by authoritative bodies that has taken into consideration the whole body of knowledge, rather than just like cherry picking and going for one or the publication over the other. Also, the WHO recommendations are underpinned by science, and we will urge countries to more or less consider adopting this.
Okay. I think one more question. Want to say against one?
Sure. I just want to reiterate the precautionary approach. We have inconclusive evidence about the health impact of e-cigarettes and HTPs. This precautionary approach has been followed in almost every public health policymaking, and I don't see why we shouldn't apply the same principle to e-cigarettes and HTPs. We need to be, I would say, humble and respect the scientific uncertainties.
Great, good point.
My point which I would like to hear is, even though the science and evidences are available, I think we should also look for the sources of these evidences. Where is it coming from? Is it from the industry? So kindly look for the sources of the funding of the scientific evidences which is available when you want to take any decisions on them.
And that should rule out, even though the Smoke-Free Foundation won't like to hear that, but because all the money, the whole $1 billion is coming from Philip Morris, that should pretty well cut out and cancel the validity and credibility of all of their evidence. And most credible scientific, leading scientific journals are not accepting or are very reticent to accept research from that foundation, given that it's a tobacco industry front group. I think, Jagdish, you have one more question? And
yeah,
then
so this question also is addressed to the entire panel, and we would like to listen about, against the backdrop of the ongoing outbreak, which we now call EVALI, that's e-cigarettes or vaping products use associated lung illness and injuries in the United States and Canada. How do we move forward with a public health approach in regulating these products? So that will be very important to know. Who will be jumping in first?
I could jump in again. Yes. So what I would say also with this one is we should act on what we know. Are these products toxic? Yes, they are. They've been demonstrated to be toxic. Are they without risk or harm? No. Are they addictive? Do they contain nicotine? And do they have the potential to addict, more or less to keep future present generation more or less to addicted to nicotine? The answer is yes. Also, do we have sufficient evidence to demonstrate that these products are efficient cessation aids? The answer is no. So what I would say is that based on what we know, regulators or countries should act to protect their citizens. So a precautionary approach, as said and done, is actually justified.
I guess speaking of the cases and deaths in the US and Canada, we have some indications like THC, nicotine, propylene glycol, but we don't have conclusions, and I think CDC is very cautious in this, which is I think the right way to do. I think this really speaks to the need for long-term evidence. You know, we have the deaths and cases, and you know, but there's still a lot of unknowns about the health impact of e-cigarettes and HTPs. So I think given we are, you know, in the TB, more of a TB conference, I just want to reemphasize that there's probably some interest in among the TB community in potentially having e-cigarettes and HTPs as cessation products. But like Randy said, there's really no evidence supporting this. And we are in the position that these products should not be used as cessation products.
Yeah. I just wanted to add my point here. Countries like the US, they have got even the system to understand what is EVALI and how many people are, you know, dying from it. They have a system of even, you know, tracking the number of cases there. But many countries will be in a situation where the citizens would be dying, and you won't even know why they are dying when they are using the e-cigarettes. So you have to think in these terms, but you don't need to set up a surveillance system to find whether EVALI is happening in your country or not. Follow the example of countries which has already done it. You don't want any one more product included to the plethora of products with which we are doomed to live with for many, many years now.
Good. We're having questions coming on the app. We also have the hot mic here, so if people from the audience want to come up as well too, we'll take. So go up to the mic, yeah, up to the mic and form a line there. Thank you very much. We also have Kate. Are you there? We have a polling question that we want you to respond to as well too, and we'll look at the results before the end of the session. So can we project that? Are we projecting that polling question? Yeah, very good.
Can I
right, so just wait for a sec, because we want to get the audience involved also in the. So the polling question is, do you think that ENNDS or electronic cigarettes could have potential public health benefits? Yes, no, not sure. So if you could get into your app, I'm not, Kate, I don't know if you want to explain how this works actually, or if that is necessary. It's okay? All right, good. All right, so jump into your union app and you'll find that question and start voting now. Our first question?
Yeah. Actually, I want to just talk about the analytic report of the CDC. So they have already analyzed about close to 2,000 cases, and out of them, 66% cases, they were having, the people were using nicotine or mixed products. And the vape industry, they are trying to project that it is because of the THC. So we should be careful. 66% of the cases, they are using nicotine or the mixed products. And there is a strong suspicion that the solvents, they may be responsible for the lung injury. So the solvents, maybe the nicotine is there or not, but solvents are always there. So we need to be careful about that. Thank you.
No, it's fine. Yeah, we're aware. I just didn't touch on it. Yeah.
Right. Any other questions from the hot mic? If not, then how do we ensure, there's a question here on the app, how do we ensure and monitor in countries that are not technologically advanced, as some have unrestrained access to internet? It's a bit, I'm not sure if we're going to be able to decipher that question. Let's take another. What is India's plan for ground level implementation of the ordinance passed on ENNDS? what's your plans for?
The first step is to have the ordinance. That was the most important. When you have the ordinance, then you implement it. But if you see now, only a few months after the ordinance, if you search the Indian websites and the online sales of where e-cigarette used to be happening maximum, none of them are available now. That's the first implementation by itself. Of course, the industry comes as usual with the several industry tactics answers like, it will go underground and illicit trade will thrive and so on. That's we are aware of that. So we will be rather the ministry has already written to the highest authorities of the state governments that the ordinance needs to be implemented, and this will continue. We will be doing this. We'll be monitoring this in future.
Thank you, Swasti. So, next question.
Why don't we ask that one now?
You can read it out.
Okay.
You have the
Is there there's another app question coming. Is there a role for using e-cigarettes as part of a formalized smoking cessation program in selected individuals who have failed other interventions?
That is a very tough question. I would go by current evidence. And also, I think I mentioned during my presentation that these products are actually quite diverse, so you can't generalize across products. So if you're talking e-cigarettes, there are currently about 4 generations of these products on the market. And then the question is about whether it can be used as part of a in a formalized setting or controlled settings. But then what we have found based on the limited evidence available is that the 3rd generation ones seem to help people, but then not all people. So it wouldn't be something I would advocate at this current point in time because the evidence is just not there to support it.
There's follow-up questions coming, Ranti, as well.
And
too.
also, just to add to Ranti's response, like we saw in Dr. Kwan's slide that people have quit successfully tobacco use when the ends were not there. So we need to remember that also.
I'll just throw in here, there's a couple of questions relating to systematic reviews. There's a few systematic reviews out there that have been published, Cochrane, New England Journal of Medicine, but at the same time there have been certain flaws identified in those systematic reviews. So let's also put that into the mix of our discussion as far as the evidence is not entirely pointing 100% in one way or another. Again, I had pointed out the harm reduction paradigm of the tobacco industry. We're on a continuum in regulation of tobacco products. One regulatory approach is a ban of ENNDS. In the case of India, there's 33 countries that have completely banned ENNDS. But then I think now with India, there's also another 4 countries that have banned HTPs. Is that right, Ranti? 3 countries, and that includes India? Yes. So that would be 4 with India. So that's on another end, and then there are regulations in the middle, actually, relating to advertising, smoke-free places, etc. And then some countries, such as the UK and New Zealand, who are looking at cessation approaches. But we don't have any country, actually, that is actually following a public health approach like the Lancet was advocating, a public health approach to harm reduction, as in needle exchange, methadone, opioids, strictly regulated, that these products are being completely regulated. The products are being directed to users. They're not being advertised, propagated, designed with tens of thousands of sweeteners and bubble gum, et cetera, A public health approach to harm reduction is very well defined. And this rodeo, 3-ring circus approach of the tobacco industry is not what we're used to as a public health approach to harm reduction, and we don't have a country yet implementing that type of a program as well too, which is that these products are only available through a medical service, only to users, not being mass marketed to youth and adolescents, etc. So we're very much in an evolution process. So why don't we go to the questions? We'll continue on the cessation, the systematic reviews. I think you had follow-up comments, Ranti and Yanchuan.
No, I just wanted to add that there was a study also was published in the New Journal England of Medicine, right. And basically it's more or less it was in a controlled environment and involved smokers who were actually willing to quit smoking. But then what we found was that obviously there are, as Doug pointed out, is that there are flaws or limitations to that study. But a large percentage of those people actually stayed on using nicotine following the study. So if you're trying to use this as a cessation tool and people are still actually addicted to the products, after a year after the study, then at the end of the day, it's not really a cessation device.
Yeah, I think the debate is much broader than just discussing it in the controlled setting for cessation. If we want to regulate, let's say if a country wants to regulate e-cigarettes as a medicinal product, then we are potentially opening up the regulated discussion to the industry interference. And we know, it's happening in many countries. And in terms of regulatory capacity, does the country have the capacity to develop the regulations and guidelines and procedures? And that's also another question. So I think we need to not just look at a scientific study in a particular setting, but we need to take into account much broader factors.
Right. Also, many of you heard of the nut study as well too, because we hear everywhere this e-cigarettes are 95% less harmful than cigarettes as well too, but there are major flaws with that expert group, so-called quote-unquote expert group. Many of the experts also had worked for the tobacco industry. There was no transparency about the data that was used that went into that figure. It's often referred to as a black box discussion that was not transparent as well too. So you really should take that 95% nut study with a grain of salt, because it is not. It's not evidence-based. It's not based on science. So we should continue to vote, please. We've got 50 votes now, so continue to vote. We'll open up the results to you shortly. And the question that's on the board here: do you think that ENNDS electronic cigarettes could have a potential public health benefits? Yes, no, or not sure. Ranti, you have a comment?
Oh, yes, I was just going to add, following on from what Gan said, that a holistic approach should be taken to harm, because you have to look at it in its entirety, because when you look at just one bit of the jigsaw, basically you're not looking at the full picture. Manufacturers tend to more or less promote these products to young people. So the type of promotional strategies they use more or less are not discriminatory. So children are exposed to all sorts of promotional gimmicks by these industries, and then we have to also look at the risk of children initiating ENNDS, and also, as we know, based on the evidence, young people who use these products are twice as likely to go on to use conventional cigarettes. So we might be also foiling an epidemic.
There's a question here. How has the industry responded to the vaping EVALI-related epidemic? Do we know that? Anyone? Maybe Ganchuan, you would have heard actually. Yeah. I think they're remaining quite mum actually. I haven't heard much at all, and I don't think there's much. Any more questions from the floor? Don't be shy. Anybody wants to go up to the hot mic as well too, because we're only getting to app questions. Anyone want to go to the hot mic before we close out? So let's look at some. Okay. Mira, why don't you go up?
This is not a question on e-cigarette so much as on the foundation. The very fact, again, that foundation is hijacking all our agenda, the agenda of the TC. How are you going to educate us to understand that it is they who are using the agenda and not us? Because many gullible people are taking it up. Look at BRAC. They took the money from the foundation and then they had to return back because they didn't realize. How are you going to educate the public, that they should have this sense of analyzing the agenda? That, the agenda is the same, but how are you going to tell us that it is the tobacco industry, PMI, which is using this agenda and not us?
When the foundation was established in 2017, we were a bit reticent in criticizing the foundation in the media because we felt the foundation at that time was not quite known to people, and they were probably appreciate the media coverage from us. But it's 2 years since the foundation has been launched, and they've given out $130 million US dollars worth of grants. So we really feel we've been thinking about ourselves. Shall we really reach out to more people beyond the public health community, beyond universities, into other sectors, to let really people know this foundation is PMI funded, and it's really an industry front group. They shouldn't work with this foundation. So we generally feel there's a need for more people to know the truth about this foundation. I think that's something I think we are probably going to consider down the road.
Anne, please introduce yourself. Stand up and introduce yourself.
Anne Jones from the Union, and also the Working Group on Protecting Children from Tobacco. I just wanted to make an observation that the industry is so good at putting us at a disadvantage. We are now in the position of trying to get every party to protect its population from the flooding of their markets with these products. And I just wonder whether we can do more at the global level in terms of a global mechanism that would perhaps use, we've talked about using other treaties. It's 30 years this month since the Convention on the Rights of the Child was first developed, and I think we really have to look at more global mechanisms to try and stop this, because otherwise we have to wait for every country to go through the long process that, as India has just gone through, and to try and protect their populations when children are the targets. The industry is ahead of us, and we are left to try and sort of catch up all the time. This is happening to us. So any thoughts about global mechanisms in addition to the FCTC?
Yes, we've actually given some thought to it, and we do receive requests from countries, as in, I would say probably about 10 every month. And what we do is more or less go to countries to build capacity to improve the implementation of the WHO FCTC. and to also to help them to build capacity to regulate this product. So it's something we're doing. Also, within WHO, what we're trying to do, or in the process of doing, is to more or less work on some systematic reviews addressing the pressing issues on ENNDS, and we hope to put out some kind of regulatory framework for the regulation of ENNDS. But then I must add that, you know, at the end of the day, it has to still be in the context of the regulatory environment, because it has to be more or less based on the regulatory climate of that particular country. But then there will be nuances, and then the country can decide to more or less take what is applicable to it from the framework. Does that answer your question?
Also, I think we should emphasize over the last 20 years, at the turn of the century, when we were first starting the negotiation of WHO's first treaty, there were no global expert groups or mechanisms to handle the tough issues of tobacco product regulation. This was an area which I was very lucky to be coordinating, the negotiation of WHO's first treaty, the Framework Convention on Tobacco Control, a real honor to do that. And through the evolution over the last 20 years, we've created what's called the regulatory pyramid. First up was the tobacco TOBREG, which is a study group on tobacco product regulation. It's a formal study group that reports to the Director General, and he or she, as the case may be, directly to the Executive Board. For example, just I think 3 days before this meeting, Ranti has, the Secretariat has launched a technical report series that focuses on electronic nicotine delivery systems mainly, and HTPs. It's a big, heavy lift getting these reports done, so as soon as we get them published, they're out of date. So I mean, this one will already have to be updated because it's sort of updated till early this year, late last year. We'll have to do it all again. The other pillar of the regulatory pyramid is the Tobacco Laboratory Network. I think we have over 50 laboratories, public health laboratories, that are not linked to the tobacco industry, because before the turn of the century, WHO had nothing to do with this. Through ISO, International Standardization Organization, the tobacco industry completely controlled all of the testing and number crunching related to contents and emissions of tobacco products. Completely fallacious. This is how the light and mild catastrophe occurred 20, 30 years ago. They manipulated the machines to manipulate the numbers, to give manipulated information to consumers. And then more recently, we've established the Global Tobacco Regulators Forum, which brings tobacco regulators together from around the world, because the tobacco industry is always exchanging information. They're competitors, but when times get tough, they go underground and they work together to counteract legislation and initiatives that they don't particularly like, actually. So those fora are there, they're developing, and they need to develop more along with the capacity building that Ranti was referring to. We got many questions coming in this app, actually, but I think we should address this briefly. Why are speakers ignoring the needs of smokers who want to quit using ENNDS? Well, I don't think that the panel has ignored. I was very clear. There's a regulatory continuum, where certain countries, 33, have felt they don't have the capacity. There are threats within their countries as well, too, so they have chosen to ban ENNDS and HTPs. Others are regulating certain aspects as well, too. Others are trying the approach to harm reduction, but we still don't have that. As I said, I was very clear, we do not have that public health approach that the Lancet was asking for last week in their position paper, for anyone who asked the question as well, too, that basically states that a medicalized approach, if you call it harm reduction, for those that want to quit, you've got to follow a public harm reduction process. Go and study needle exchange, needle injection sites, methadone clinics, naloxone clinics now with the opioid epidemic that's killing tens of thousands of people. Go and look at that. We don't have that as part of the natural experiment. So I don't think that there has been tunnel vision And I think that, Ranta, you also had pointed out there's 4 major precepts that WHO has pointed out for regulation that we have proposed in the past. Maybe you want to elaborate on those 4, the square you had as far as regulating, preventing.
Oh, yeah. Before I talk about that, basically, when it comes to ENNDS, in more or less answering this question, in certain countries, the option to have ENNDS licensed as medicinal products is open to people or to countries. But then the thing is, no manufacturer. I wonder why. Probably it's because it's not commercially viable to them. But then there is no ENNDS on the market which is actually, a licensed medicinal aid. And also, as I said earlier, these products are quite diverse and we can't generalize across products. And then there are nicotine and non-nicotine pharmacotherapies which are prescribed and used under controlled conditions that can help smokers to quit. So we're not ignoring that question. So just to reiterate, the 4 regulatory options are: 1, to prevent initiation, to protect users and non-users from the emissions of ENNDS, to more or less prevent unproven health claims, and also to protect against the commercial and vested interests.
And that can be done from regulatory approaches coming like India, which is a ban, other regulatory approaches, whether those are regulating as tobacco products or medicinal products, and yet the harm reduction approach. But we don't have yet a country or jurisdiction doing a harm reduction approach from a public health approach. So that's very clear, and I think that's a really important takeaway message from this session and what's coming out of the Lancet publication. Kate, before we close, can you put up the polling results, actually? So beat the drums now, and let's see how. So, do you think that ENNDS electronic cigarettes could have potential public health benefits? There are 12 of 57 votes that say yes. There are 35? My myopia. Yes, 35 of 57. So the majority say no, and then there's 10 out of 57 not sure. So sounds kind of like a Brexit vote to me, actually. So, but at least the majority, we do have a majority there. We actually have those that are no and not sure are 45 out of 57. So the majority, at least in this audience, feels that they're not convinced that ENNDS could have yet public health benefits with the data that we have currently. So with that, I'm going to invite my co-chair, Jagdish Kaur, to sum off and close our session.
So thank you so much, audience, for being with us. It was a great session, and we had a great, end of this voting where we can see the clear what should we do with these products. So, join me in giving a round of applause to our wonderful speakers. And we could learn about science of these new products, nicotine and tobacco products, and we could learn the regulatory challenges. We could learn from India's example how to go about this. They have taken the extreme step of banning and a very comprehensive ban. And there are some take-home messages from this session. Now we are very sure that these products are harmful and injurious. They are to the human health, and they must be regulated. We must protect especially our young people, their health. And then this regulation, it can be a ban, which is the extreme end of the spectrum. It can be other forms of regulation, which some other countries are following. And we have to look at the international guidance, regulations, and the evidence base which is available for these products. And certainly we cannot buy into the mass marketing harm reduction paradigm of the tobacco industry. And lastly, as Douglas repeatedly, reiterated, that a public health approach is required. So that is the end of this session. Thank you very much once again. Thank you.